Are you curious about Anafranil and what it is used for? Look no further, as this video will provide you with all the information you need to know. Anafranil is a medication that is commonly prescribed for various conditions, and understanding its uses, dosage instructions, potential side effects, and user feedback is vital to ensure its safe and effective use. Anafranil, also known as clomipramine, is primarily prescribed for the treatment of obsessive-compulsive disorder, OCD. It belongs to a class of medications called tricyclic antidepressants, which work by increasing the levels of certain chemicals in the brain that affect mood and behavior. Aside from OCD, Anafranil may also be prescribed for other conditions such as depression, panic disorder, and certain types of chronic pain. However, it's important to note that any use of Anafranil should be done under the guidance and supervision of a healthcare professional. As with any medication, Anafranil comes with potential side effects, and it's essential to be aware of these before starting treatment. Some common side effects include dizziness, drowsiness, dry mouth, constipation, and blurred vision. To gain further insights into Anafranil, its uses, dosage instructions, potential side effects, and user feedback, keep reading this video. Common uses of Anafranil. Anafranil is primarily prescribed for the treatment of obsessive-compulsive disorder, OCD. OCD is a mental health condition characterized by recurring unwanted thoughts, obsessions, and repetitive behaviors, compulsions. These obsessions and compulsions can significantly interfere with daily life and cause distress. Studies have shown that Anafranil can effectively reduce the frequency and severity of obsessions and compulsions in individuals with OCD. It helps to restore the balance of certain chemicals in the brain, such as serotonin, which play a role in regulating mood and behavior. In addition to OCD, Anafranil may also be prescribed for other conditions such as depression and panic disorder. It can help alleviate symptoms such as sadness, loss of interest, feelings of guilt, and excessive worry or fear. Furthermore, Anafranil has been found to be effective in managing certain types of chronic pain, such as neuropathic pain and fibromyalgia. It can help reduce pain intensity and improve overall functioning in individuals experiencing chronic pain. It's important to note that Anafranil should only be used for the specific conditions prescribed by a healthcare professional. The dosage and duration of treatment will vary depending on the individual's condition and response to the medication. Dosage instructions for Anafranil. The dosage of Anafranil will be determined by a healthcare professional based on various factors, including the individual's age, weight, medical history, and the severity of the condition being treated. It's important to follow the prescribed dosage instructions carefully and not to adjust the dosage without consulting a healthcare professional. Anafranil is available in tablet form and is usually taken orally. The tablets should be swallowed whole with water and can be taken with or without food. It's recommended to take Anafranil at the same time each day to maintain a consistent level of the medication in the body. The initial dosage of Anafranil for OCD is typically low and gradually increased over time to reach the effective dose. This helps minimize potential side effects and allows the individual to adjust to the medication. The maximum daily dose of Anafranil for OCD is usually around 250 milligrams. For depression and panic disorder, the dosage of Anafranil may differ from that of OCD. Again, it's crucial to follow the dosage instructions provided by a healthcare professional to ensure safe and effective use of the medication. If a dose of Anafranil is missed, it's recommended to take it as soon as remembered. However, if it's close to the next scheduled dose, it's best to skip the missed dose and continue with the regular dosing schedule. Taking a double dose to make up for a missed dose is not advisable. Potential side effects of Anafranil. Like any medication, Anafranil can potentially cause side effects. It's important to be aware of these side effects to ensure prompt medical attention if necessary. It's worth noting that not everyone who takes Anafranil will experience side effects, and the severity and frequency of side effects can vary among individuals. Common side effects of Anafranil include dizziness, drowsiness, dry mouth, constipation, blurred vision, and weight gain. These side effects are usually mild and temporary, and they may improve as the body adjusts to the medication. Drinking plenty of water, maintaining good oral hygiene, and eating a balanced diet can help manage these side effects. Less common but more severe side effects may include rapid or irregular heartbeat, chest pain, difficulty urinating, seizures, confusion, and hallucinations. If any of these side effects occur, it's important to seek immediate medical attention. Anafranil may also interact with other medications or substances, leading to potential side effects or reduced effectiveness. It's crucial to inform a healthcare professional about all the medications, supplements, or recreational substances being taken to avoid potential interactions. User feedback on Anafranil. Understanding user experiences and feedback can provide valuable insights into the effectiveness and tolerability of Anafranil. It's important to note that individual experiences may vary, and what works for one person may not work for another. Many individuals who have used Anafranil for OCD report significant improvements in reducing obsessions and compulsions. They describe feeling more in control of their thoughts and behaviors, which greatly improves their quality of life. Some users also report improvements in depression and anxiety symptoms when taking Anafranil for comorbid conditions. However, it's worth mentioning that some users may experience side effects that can be bothersome or impact their daily functioning. These side effects can vary from person to person and may range from mild to severe. It's important to communicate any side effects to a healthcare professional to determine the best course of action. It's advisable to discuss user feedback and experiences with a healthcare professional to gain a comprehensive understanding of the benefits and potential drawbacks of using Anafranil for specific conditions. Alternatives to Anafranil. While Anafranil can be effective for many individuals, it's not the only option available for the treatment of OCD, depression, panic disorder, or chronic pain. There are alternative medications and therapies that may be considered based on individual needs and preferences. Selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed as a first-line treatment for OCD. Medications such as fluoxetine, fluvoxamine, and sertraline have been found to be effective in reducing OCD symptoms. They work by increasing serotonin levels in the brain, similar to Anafranil. For depression and panic disorder, SSRIs are also commonly prescribed. Other classes of antidepressant medications, such as serotonin norepinephrine reuptake inhibitors, SNRIs, and atypical antidepressants, may also be considered based on the individual's needs and response to treatment. In some cases, psychotherapy, such as cognitive behavioral therapy, CBT, may be recommended as an alternative or complementary treatment to medication. CBT focuses on identifying and changing negative thought patterns and behaviors associated with the condition. It's important to discuss alternative treatment options with a healthcare professional to determine the most suitable approach for managing specific conditions. Precautions and warnings when taking Anafranil. Before starting treatment with Anafranil, it's important to inform a healthcare professional about any pre-existing medical conditions, allergies, or medications being taken. Certain medical conditions or medications may interact with Anafranil, potentially leading to adverse effects or reduced effectiveness. Anafranil should not be taken by individuals who have a known allergy to clomipramine or any other ingredients in the medication. It's also important to inform a healthcare professional about any history of seizures, heart problems, liver or kidney disease, or urinary retention. The use of Anafranil during pregnancy or while breastfeeding should be carefully considered. It's essential to discuss the potential risks and benefits with a healthcare professional, as the medication may pass into breast milk and affect the infant. When starting Anafranil, it's common to experience dizziness or drowsiness. It's important to avoid driving, operating machinery, or engaging in activities that require alertness until the individual's response to the medication is known. Abruptly discontinuing Anafranil can lead to withdrawal symptoms, such as nausea, headache, irritability, and sleep disturbances. It's important to follow a healthcare professional's guidance on gradually tapering off the medication when discontinuing treatment. Research and studies on Anafranil. Anafranil has been extensively studied in various clinical trials and research studies to evaluate its safety and effectiveness for different conditions. These studies have provided valuable insights into the benefits and potential side effects of Anafranil. Several randomized controlled trials have shown the efficacy of Anafranil in reducing obsessions and compulsions in individuals with OCD. The medication has consistently demonstrated a significant reduction in symptom severity and an improvement in overall functioning. In a study comparing Anafranil to SSRIs for the treatment of OCD, both medications were found to be effective. However, Anafranil was associated with a higher rate of side effects, particularly in the initial stages of treatment. This highlights the importance of careful monitoring and individualized treatment plans. Research has also explored the use of Anafranil for other conditions, such as depression and panic disorder. While the evidence is not as robust as for OCD, Anafranil has shown promising results in reducing depressive symptoms and alleviating panic attacks. It's worth noting that ongoing research and studies continue to contribute to our understanding of Anafranil and its potential applications. It's important to stay informed about the latest research findings and consult with a healthcare professional for the most up-to-date information. Conclusion and final thoughts. Anafranil, also known as clomipramine, is a medication commonly prescribed for the treatment of obsessive-compulsive disorder, OCD. It belongs to a class of medications called tricyclic antidepressants and works by increasing the levels of certain chemicals in the brain that affect mood and behavior. In addition to OCD, Anafranil may also be prescribed for other conditions such as depression, panic disorder, and certain types of chronic pain. It's important to follow the prescribed dosage instructions and be aware of potential side effects. Individual experiences with Anafranil may vary, and it's important to communicate any side effects or concerns to a healthcare professional. Alternatives to Anafranil, such as other medications or psychotherapy, may be considered based on individual needs and preferences. Before starting treatment with Anafranil, it's important to discuss any pre-existing medical conditions, allergies, or medications being taken with a healthcare professional. Certain precautions and warnings should be considered to ensure safe and effective use of the medication. Research and studies have provided valuable insights into the efficacy and safety of Anafranil for various conditions. Ongoing research continues to contribute to our understanding of this medication. Remember, this video is intended for informational purposes only and should not replace professional medical advice. If you have any questions or concerns about Anafranil or its use, it's best to consult with a healthcare professional.